Good day! I'm Camille M. Macanilaw, your student nurse from Nueva Ecija University of Science and Technology. And for today's video, I will show you how to perform tracheostomy care. The goal of this procedure is for the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. The equipment we'll be needing: check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut and sewn surgical dressing, sterile basin, small sterile brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves 2 pairs, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. And for the implementation, bring necessary equipment to the bedside stand or overbed table. Perform hand hygiene and put on PPE if indicated. Next is identify the patient. Ma'am, ano pong pangalan nyo?
Carmela de la Cruz.
Then, close the door or close the curtain around bed if possible. Next, determine the need for tracheostomy care. Then, explain what you are going to do and the reason to the patient even if the patient does not appear to be alert. Ma'am, ang gagawin po nating procedure ay lilinisin ko po ang inyong tracheostomy tube para po sa inyong hygiene at para po maiwasan po natin yung infection. Okay lang po, ma'am. Then, adjust bed to comfortable working position, usually elbow height of the caregiver. Then, lower side rails closest to you. If the patient is conscious, place him or her in semi-fowler's position. If patient is unconscious, place him or her in the lateral position facing you. Then move the overbed table close to your work area and raise to waist height. Next, check the lung sound. Then, place the towel below the trachea site, covering the neck and chest of the client. Next, prepare the basins and cleaning solutions. Mix sterile water or plain NSS and hydrogen peroxide in 1 basin. Be sure it will fill 0.5 inch of the basin. And in the second basin, put only plain NSS. Then perform gloving. Next, remove the oxygen source if one is present. Stabilize the outer cannula and face place of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Then gently remove the inner cannula and place in first basin with plain NSS and hydrogen peroxide. Let it submerge there for few minutes. Simultaneously, gently slide the tracheopod or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, or inflammation. Now, clean the inner cannula of the tracheotube using the prepared plain NSS with hydrogen peroxide and use brush to remove solidified or sticky mucus. Then rinse using the second basin with plain NSS only. Then discard gloves and put on another gloves if necessary. Now, dry the inner cannula using a sterile gauze pad. Pat dry. Then gently reinsert it back to the tracheostomy tube. Be sure it is properly locked.
Okay, ma'am. Tingnan na po natin.
Now, dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under face plate. Then use each applicator or sponge only once. Another one for the bottom. Then pat skin gently with dry 4x4 gauze sponge. Next is slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the face plate. Then check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Then reapply oxygen source if necessary. And remove gloves, assist patient to a comfortable position. Raise the bed side rail and place the bed to the lowered position. Then remove additional PPE if used, then perform hand hygiene and do the documentation. And lastly, we assess patients' respiratory status including respiratory rate, effort, oxygen saturation, and lung sounds. All the respiratory status are normal.